From a new strain of Mpox emerging in California to pandemic fears in China, and even a breakthrough in organ transplants, this week's health headlines are both alarming and fascinating. Here's what you need to know right now. According to health officials, 2 Californians diagnosed with Mpox may be the first US cases resulting from the local spread of a different version of the virus. And though health officials say the risk to the public is low, but these are not the US first cases of what is known as Clade I Mpox. The Clade 1 case is the nation's first, in a person with no recent travel history, and the 7th Clade 1 case in the country. Until now, all US cases were linked to travelers infected abroad. Both patients were hospitalized, but are now recovering. Public health officials are reviewing the patient's potential source of exposure and conducting contact tracing. So far, no other cases have been identified. Experts warn that this strain, related to smallpox, can cause severe rashes, fever, and body aches, and it's spreading closer than we think. Next, a new IDV swine flu variant detected in China has sparked pandemic fears, with experts fearing it may have developed the ability to jump between animals and humans. A team of Chinese researchers has identified a mutated influenza D virus that has now jumped from animals to humans. It spreads through the air, resists current flu drugs, and, most worryingly, may already be spreading silently among people. Experts are calling it a potential pan-zootic threat, meaning a pandemic that could cross both animal and human worlds. The warning is clear. This could be the next big one. Cambodia reports another human H5N1 avian influenza case. In Cambodia, a 3-year-old girl has become the 16th human case of H5N1 bird flu this year. She's in intensive care after testing positive, with symptoms including fever, cough, and stomach pain. Authorities say this spike is deeply worrying, as H5N1 continues to infect both birds and humans in Southeast Asia. Now, scientists found how post-COVID smell loss linked to brain. Scientists studying long-term smell loss after COVID have made a striking discovery published in scientific reports. The problem isn't just in your nose, it's in your brain. MRI scans show that the olfactory regions shrink and lose grey matter, meaning the brain's wiring itself is damaged. That's why recovery is so slow. It's not a sinus issue, it's neurological. Experts now call it physical therapy for the brain, and say new treatments must help the brain heal, not just the nose. Now, a major breakthrough in organ transplants. Scientists have created a universal kidney that could match any blood type and save countless lives. After a decade of work, researchers in Canada and China have created the first ever universal kidney, one that can match any blood type. In tests, the organ functioned successfully for several days inside a body of a brain-dead recipient whose family consented to the research. Here's how it works. Scientists managed to turn a type A kidney into a type O kidney using special enzymes. These enzymes act like tiny molecular scissors, cutting away the sugar molecules that mark a kidney as type A. Once those markers are removed, the kidney becomes antigen-free, just like type O blood, which can safely match with any blood type. At the moment, 11 people die waiting for a kidney transplant each day in the US alone, and the majority of those are waiting for type O kidneys. If perfected, this could end years-long waiting lists and make kidney transplants faster and safer for everyone. From viral mutations to medical miracles, this week shows us both sides of science, danger and discovery. Subscribe to Health Bulletin, your weekly dose of truth, science, and the stories shaping our health and our future.